Good day, my name is Nicole Rigaspi, Sasaluya Bachelor of Science in Nursing Section 1F of Camarines Polytechnic Colleges. Today I am going to demonstrate assessing the eyes. The purpose of this is to help point out the eye disease and condition that can affect your brain and the nervous system. First, we need to prepare the equipment. We need the fan light, Snellen chart, and the Jagger chart. Next is we need to provide the client's privacy. I already closed the door and the window for the client's privacy. Then next, let's perform hand hygiene to prevent the transmission of microorganisms. Then next, we are going to introduce ourselves to the patient and explain the procedure and how she can cooperate. So, good day, ma'am. My name is Nicole Rigaspi Sasaluya. I am going to be your student nurse for today. So, may I know your complete name, birthday, and age?
My name is Carotid Artery, December 14, 2002, 19 years old.
Okay, so today, ma'am, I am going to assess your eyes. Is that okay with you? So, in order to do that, I will be needing your cooperation. So, for the assessment, inspect the eyelid and the lashes for the position and appearance. Okay, so next, ma'am, can you blink your eyes 15 times? Okay, ma'am. So next, inspect the iris and the pupil for the shape, equality, and the color. So the shape is round and the equality is equal and the color is in a uniform color. Next, before we start to the procedure, ma'am, I am going to ask you something. So, ma'am, did you notice recently any changes in your vision like double vision, blurred, or cloudy vision?
Cloudy vision.
Cloudy vision, okay ma'am. So, eye pain po.
Meron.
Redness or swelling.
Meron.
Eye discharge. History of proper eye surgery. Trauma. Use of corrective glasses or contact lens. Eye care habits. Ma'am, did you use sunglasses and anti-radiation glasses?
Sometimes.
Okay, so are you taking any eye medication? Okay, so let's proceed to the procedure. So for the visual acuity test, we are using the Snellen chart for assessing the cranial nerve 2, which is the optic nerve. So ma'am, now we are going to test your visual acuity, and now what we are going to do, ma'am, is to get away 20 feet from the Snellen chart. So ma'am, then try to read the chart in a red line and then cover your right eye, ma'am. Then can you please read the red line?
D-E-F-T-O-T-E-C.
Okay, ma'am. Next is the other side naman po.
D-E-F-T-O-T-E-C.
So, the client's vision is 20/20. So, the client's vision is normal. Then next, ask the client to hold the Jagger chart. Ma'am, can you please hold this Jagger chart? And I am going to measure 14 inches away from your face. Okay, ma'am. So, ma'am, can you please read the smallest line? This one.
Able treated the restriction of the standards and prisoners which have been taken in the defect crisis, his generals in the early part of his reign attempted the reduction of Ethiopia and Arabia Felix. They marched near 1,000.
So, okay, ma'am. Thank you. So, next is the EOM, which is the Extraocular Muscle Function Test. So, ma'am, you need to stare at a distant object. Then, I am going to test your Okay, ma'am, I see that there is an alignment and there is a symmetry in your eyes, and that's good to know. The next procedure is the PERRLA, which is the pupil equally round, reactive to light, and accommodation. So, stand in front of the patient in a darkened room. So, we need to close the light. Then, ask the client to look straight ahead. Ma'am, can you please look straight ahead? And then, move the pen light to the right side of the client's face and focuses the light on the right pupil. The next is in the other side. Okay. Next, I am going to demonstrate is the assessing the ear. So, the purpose of this is to maintain the proper hearing aid function. So, before we start to the procedure, ma'am, I am going to ask you something. Is that okay with you?
Yes.
Okay, so, ma'am, did you notice recently any changes in your hearing?
No.
Did you feel any ear pain?
No.
Did you hear any ringing or cracking in your ears?
No.
How about dizziness, unbalance, or spinning?
Yes.
Ma'am, did you take any ototoxic medication like aminoglycosides, macrolide, or anti-malarial?
None.
Okay, so for the assessment, inspect the internal ear for the size and shape. So the ears is in equal size and similar appearance. And then for the position, so the position is normal, and the lesions and the discolorations. So the skin is smooth and the skin is color brown. And then for the consistency is normal. Then let's proceed for the procedure. Then for the voice whispering test, so give instruction to the patient to repeat the word that the nurse will say. So ma'am, I am going to say something and you will need to repeat it. Okay? So I need to stand and 2 feet away to the patient. And ma'am, can you please side your chair? Okay. 2 feet away. And then, ma'am, can you please cover your left ear? Over there. Okay. And then, I am going to say some words. 5, dog, 1.
5, dog, 1.
And then repeat into the other side. 5, dog, 1.
5, dog, 1.
Okay. So, next procedure I am going to do is the Weber test. So, stand in front of the patient and give instructions to the patient that you will place a tuning fork on the top of his head and ask if she hear the sounds equally in both ears. So, let's assume that this is the tuning fork. So, ma'am, did you hear equal sounds in your both ears?
Yes.
Okay. The next procedure is the Rinne's test. So, stand behind or to the side of the patient and give instruction to the patient that you will place a tuning fork on the base of his ear. And then instruct the patient to indicate if the sound is heard. So, ma'am, I am going to place the tuning fork. Then, ma'am, please tell me if you hear the sounds and when it is stopped.
6 seconds. 8 seconds.
Okay, ma'am. So, next procedure I am going to do is the Romberg test. So, the patient must stand straight and the feet are closed. And then, ma'am, can you please Open your eyes in 10 seconds, and after that, close your eyes in 10 seconds. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, close your eyes, ma'am. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the client's Romberg test is negative because the patient is not full. Next I am going to demonstrate is the assessing the heart. So before we start to the procedure, I am going to inspect the patient. Is that okay with you, ma'am?
Yes.
So I am going to palpate your pulse. And then next, I am going to palpate your apical pulse. Okay. So, for the procedure, I am going to auscultate the heart. So, I am going to use the stethoscope. Then, I am going to use the diaphragm and identify the first sound S1 and the second sound S2. Okay, ma'am is, so the sound of your heart, ma'am, is normal. Then last I am going to demonstrate is the assessing the neck. So I am going to assess the carotid artery. First, we need to find the pulse of the patient using my 2 fingers. Then after we find it, I am going to use my stethoscope. Using the diaphragm. Okay, so the carotid artery of the patient is normal. And then that's the end of my demonstration. Before that, we need to perform hand hygiene to prevent the transmission of microorganisms to one patient to another. And then document all the relevant informations. And that's all.